Welcome again to my YouTube channel. Sa mga bagong subscribers ko, maraming salamat for tuning in. Sa mga older subscribers ko, alam ko nandiyan kayo, naghihintay lang sa mga videos ko. Today, it's gonna be breastfeeding, okay? May mga nanay na naman na nag-request sa akin ng specific lectures about breastfeeding. They message me at nangangailangan sila ng tulong how to do this, okay? So, as I mentioned before, I teach breastfeeding dyan sa atin sa Pilipinas, and I also teach breastfeeding sa mga nurses dito sa ibang bansa, sa Canada. So, I am their lactation consultant dito sa Canada. So, ako ngayon ang magbibigay sa inyo ng information kung paano magbe-breastfeed ang isang nanay na malaki ang breast, okay? Years ago, in our history, sa ating mga ninuno pa, there are not so many women, Filipino women, years ago na malalaki ang mga breasts. Because again, it's our genetic, kung ano yung pinanggalingan natin, minsan yun din ang kukuha natin. But because nowadays, marami na mga interracial marriages, meaning mga Pilipina nakapagpangasawa ng taga-ibang bansa. So may mga millennials na ngayon na may malalaki ng mga breasts. This is the big breast. So, kalimitan ng mga nanay na tinitingnan ko dito sa ibang bansa ay malalaki ang breast because again, yun ang mga genetics nila. Doon sila, mga nanay nila, ganun din, malalaki din ang breast. So, napapansin ko yan sa mga pasyente ko, mga Asian. Na may mga Asian talaga ako mga pasyente na malalaki din ang mga breast. And I will give you a very specific example kung paano mag-breastfeed ang isang malaking breast. So, one day in my nursing career, when I was working as a full-time lactation consultant sa maternity unit sa isa sa mga hospital dito sa Canada, there was a mom na taga-ano siya, i-mention ko lang siya ha, na taga-Vietnam siya. Okay. This mom ay like siguro mga 5'9" lang ang height. 5'9" lang ang height. So, maliit talaga siyang pagkananay. So when I came in that morning, ang sabi ng mga nurses, Alona, please help the mom at the room, so and so, kasi hirap kaming magturo sa kanya paano siya mag-breastfeed. So they did not tell me anything more kung anong dahilan kung why she is struggling with breastfeed. All I know that she has a big breast. So anyway, and the baby was so small. So the baby was so small, but she had a big breast. Anyway, so I went in there, I checked, and I said, "Hi, kumusta? How are you?" Sabi ko, "So I heard na you're struggling breastfeeding." Sabi, "Yeah." So sabi ko, "Do you mind if I look at your breast?" So, you have to ask permission, of course. Kahit sabihin mong doktor ka, nurse ka, or lactation consultant ka, you need to ask permission bago ka tumingin, bago ka mag-touch. Anyway, when she opened her gown, I was shocked. Hindi ko pinakita yung expression ng mukha kong pagka-shock. I was shocked when I saw the size of her breast. Why? Yung breast niya is almost ganito kalaki at ganito kahaba. So imaginein mo, I'm not exaggerating this, literally, almost ganito kalaki ang nakita ko. Okay? Literally, yung breast niya, so normally our breast is here, right? Yung breast niya, yung dulo ng nipple niya, so I'm gonna stand up. Ang dulo ng nipple niya was already down to her hips. So when I was looking for her nipple, doon ko tiningnan lower hips. Ganito kalaki yung breast niya that's laying down beside her. Now, I'm gonna ask you now, saan mo ilalagay si baby when you're breastfeeding this? Because yung nipple niya, nasa hip line na niya, kaliit niyang babae, yung baby niya very tiny, yung katawan ng breast niya, yung body ng breast niya, mas malaki pa sa tiyan ng baby niya. Ganun kalaki. So, I'm not exaggerating, this is typically the size of her breast. So, how did I do it? So, I know that she cannot hold the baby down there to her hips while she's breastfeeding. So what I did, kung ang breast niya is going this way, I put the breast horizontally. So ang breast, I put the breast right on top of her on top of her tummy, and put the baby to the opposite side. Nakuha nyo? So if your breast is so big like this, you flip it to this side. So ang baby nandito, the breast is the left side, but the baby is breastfeeding in the right side. So nandoon yung nipple sa side ng baby. That's the way how I breastfeed that baby. Doon sa oblong, long-shaped breast. Now, how about if the breast is so big and so round? Okay. Minsan, when you're breastfeeding mommy and your breast is so big, especially when your milk is already established and you got tons of milk already, so sometimes it double the size. So what you can do if you have a big round breast and your baby is small, so could you imagine if your baby's face is so small and your breast is maybe twice the size of your baby's face? It happened. I have that many pasyente na ganun. So what you're gonna do? Para yung weight nitong breast na to is not laying on top of your baby's chest. Because imagine, you're breastfeeding, so the baby is here, but the weight of your breast ay nandito sa chest ng baby. What you're gonna do? Ta-da! So you get a face towel or a hand towel. A face towel is too small. Get a hand towel. So a hand towel is longer this, okay? So what you can do is fold it, quarter, roll it, and put it underneath your breast. So if you're breastfeeding, so you put it underneath your breast. So when the baby latch, yung weight ng breast mo nasusuportahan dito sa towel na to. Ang breast nyo ay hindi, the weight of your breast is not on top of the baby's chest because this towel is supporting the weight of your breast. That's the best way on how to breastfeed with a large breast. Okay, another technique that I teach mom on how to breastfeed, because there are times na the baby is preterm, the baby is too small, and the breast is still so big for the baby. The mom is struggling like paano how to hold the breast. So what you can do is when you're eating in your kitchen table, eating it or counter table, whatever, put your breast in there. So this is the counter table, right? This is the counter table. Put your breast in there. Put the baby on the counter table. Put a blanket, lampin, put the baby in there. Breastfeed the baby while you're putting your breast on the counter table. So this is gonna be positioned where the counter table is to support the weight of your breast. Okay? You can do this one too if you have C-section. Kasi sometimes when you have C-section, you have discomfort and pain down there, right? So kailangan mo na to make sure that your C-section is untouched. So what you can do, put this breast on the counter table, breastfeed, so less pressure down in your C-section when you do that. So those are the tips for today na hindi na tinuturo ng mga doktor nyo, okay? Maraming paraan kung paano magbe-breastfeed ang nanay. But when the baby is still very small, talagang maghanap ka ng paraan, nanay, on how you feel comfortable. Pag malaki na si baby, walang problema kahit anong position gawin mo. But during this preliminary periods na you're still learning, your baby's still learning, so you have to make sure na komportable ka when you're breastfeeding, because if you're not comfortable, kahit when you're excuse me, kahit pag upo mo na hindi ka komportable yung puwit mo because of your cut down there, put a pillow on your side, napiktuhan. It's affecting how you position, it's affecting how you're latching, and it's also affecting on your milk flow. Because if you're not comfortable, walang letdown na lumalabas sa iyo. So it's always good to find ways on how you can breastfeed with different types of breast size. So if you have a breast who's just a small size like this, so this is like a second size to this. So if you have a breast who's just this size, So this is one of the easiest size of breast that I've experienced in our breastfeeding clinic. So napakabilis mag-breastfeed sa size na to, and most Filipina of size like this. Now, it's always remember, do not underestimate, do not get jealous na yung ibang nanay, they have big breasts. Do not get jealous because some women with smaller breasts have tons of milk as compared to women who have big, huge breasts. So again, it's a matter on positioning, latching, how you hold your breast. So there were some questions that may nagtatanong sa akin, do you always have to hold your breast when you're breastfeeding? For beginners, sa mga bagong nanay, smaller babies, if you can maintain holding your breast maybe 5 minutes, 2 to 5 minutes, when you feel like napifeel niyo na yung tagging, sucking the baby, then you can let go. But if you feel like within that 5 minutes, medyo mababaw pa rin yung latch, hindi pa rin masyadong maganda yung tagging ni baby, so don't let go. Because the minute you let go, if let's say pretend you're holding a C-hole, malaki yung breast mo, and then yung baby mo na still struggling, paano talaga makuha yung pinaka-areola part, not just the nipple but the areola part. If you let go this, okay, think about it, if you let go, see, na-stretch ulit. So nawawala yung cupping, nawawala, the latching becomes shallow, naging mababaw, because you let go. But if you keep it in a C like this, and waiting until the baby fully cupping the areola, and you feel a good tagging maybe around 2 or 5 minutes, then that's the time you let go. Yun ang kamalian ng mga nanay. Pag latch nila, when they latch it, they let go right away, and then the baby, they think the baby is sucking deeply. So they just don't, they're so busy with their cell phone, not realizing that the latch is shallow. Then later on, nagiging sore yung nipple, the nipple red cracks, and guess what? The baby's always hungry because the baby did not get the milk that the baby needs because the latch is shallow. It was not a good latch. So again, either you have a big breast, a middle size, or a small breast. It's a matter on how you hold it, how you latch the baby, and how you position the baby. So I hope you learned something again from this video of having a large breast. Be thankful if you have a large breast because that means you have a large capacity of storage capacity. If you have a smaller breast, don't worry. Sometimes you get too much milk. Sometimes you also have a little bit of milk. But it's a matter on how the baby is breastfeeding. Okay? So again, thank you for watching. Please share this video. Continue to subscribe. Do your comments. Ask me what you want me to discuss about breastfeeding, pregnancy, nursing, babies, whatever. Ask me and I will do it. I will do the video and share it with you. Thanks again for watching. I'll see you. More videos to come. Bye.